So the sessions involve, are based on, it's not just symptom based, it's about social skills development, it's about learning to manage emotions and problem solving and developing better problem solving skills. So when they're bullied or when they're having problems at school, they can cope better with those situations that arise. So the first session is about pay attention and be a good detective. The whole thing follows a detective theme. When we teach that, we say you're going to become a detective that can, recognise problems and solve problems. So they develop police detective problem-solving skills. They're taught to scan for anger and how to control it. Same for anxiety. They learn in the 5th session how to scan behaviour and understanding others. The point is, if they can see a problem heading their way before it's hit them in the face, then they can intervene earlier in the process and perhaps do something about it. How to analyse their problems appropriately, to engage in a consequential thinking process, and to think of problem solutions and to select the most appropriate solution. Then they have to act on it, so they have to have behavioural control, they have to stop, think, respond, and then finally a session that we call Use It or Lose It, which is all about practice and start to use these skills in your daily activities, and that's where the coach comes into play. Whole thing, as I said, runs on the detective theme, which is, and we have thinking tools that cue a way of thinking. And the key one is SARA, which is a problem-solving tool that we tell the children is actually used by Scotland Yard. And if they go on the internet, they can find it. We've adapted it, simplified it, of course, but it's all about SARA is scan, recognise and spotting problems, analyse, collect information to find the best solution, respond, which is the action, and then to assess, to review the action. Would it have been better to do something different? If you've got lots of solutions to a problem, then if you've got lots of ideas, if the first thing you do doesn't work out, then there are other opportunities, other things that you can do. Other thinking tools have actions, and the coach learns these actions too, so they can cue some behaviours, whether they're in the supermarket or they're out but so they don't have to tell the child off, they can cue a set of behaviours. So one is like self-talk, the kids love this one, self-talk, where we teach them that will cue to tell themselves to motivational statements or self-calming statements. Breathing is just going like this, is a physical method that they're taught that will cue like breathing techniques to help them calm down. Safe place is a cue like this, which encourages the child to imagine a reassuring place where they feel comforted and safe. Body language, like this, teaches the child to notice other people's body language and to use their own effectively. If they learn to pay attention to their own body language, that feeling inside that something's not quite right or going wrong, that gives them a cue that something might be going to kick off. Or if they notice other people's body language, or even tone of voice, they know. Don't we all know? Didn't we all know when we were kids, when we were in trouble, just by our parents saying our name in one way? Susan? Just that way you knew that there was trouble. The 5 W's tells children that what questions to ask. Who, what, where, when, why. If you ask the right questions, you get the right answers. Trust teaches them where information is coming from. Are they going to trust the information that their school friend has told them, or are they going to trust the information that their teachers told them? It's about a hierarchy of trust. Stop and think cues them not to act impulsively or to just stop and calm down and think for a minute. Brainstorm cues them to think of lots of alternative solutions. Don't pick the first thing that springs to mind. Plus and minus to look at the good and bad points of a solution, and me and you to think about the consequences of actions for themselves and other people. This is an example of one of a child's rap book they're encouraged to illustrate it and make them colourful, to make them, become their own possessions and to become a resource that they can refer to and use. Here's another one from within the rap book, and this here is a time machine, where one of the exercises is for them to go back in time to think about how they would have resolved a problem that they worked on in the session with the skills they have now, how they would resolve it differently. Now they know what they know. This is an example of an angry person where they've had to, actually this face bit isn't in there, it's actually a blank face. This child has drawn in this face, quite an artist, and has written angry thoughts here. The coach guide summarises the sessions, it says what homework there is, it gives tips, do's and don'ts for parents, basic behavioural management skills, and it teaches them to support the child to transfer skills learned in the session into everyday life. It gives guidance for the coach, and it's a resource for future reference. Oops. Well, we piloted it in a school, and it's not uncontrolled, so it's just a pre-post. 92% of the children completed this group, and what we have here are medium to large treatment effects. Large treatment effect for conduct, medium effect for emotional control and ADHD symptoms, and a large treatment effect for a total score, which in adults, this total scale has been associated with life satisfaction. This was a rating scale that was adapted for children. So the next one I'm going to talk about is which one was it? Can't remember. Is the Young Brahman program, which is this one at the end, the orange one. That was developed for adolescents and adults. It's a tailored CBT program for ADHD. And when I wrote this was the first one of its kind. There just weren't any others around at all. And we were treating people at the Maudsley, and we just had to develop our own programs. And it was developed from talking to our patients and developed from just basic experience. It can be run in individual or group therapy, and this is now, it's translated into Spanish, Polish, Norwegian and Chinese. So it's pretty international. I have another version, a children's version, which is, we just submitted it this week, and I hope to be published in 2016. And it draws on all these different techniques, putting together the best of all different sort of paradigms in the strategies and techniques within the program. The structure of it is that it has a background section that tells you about the program, and then it includes modules for attention, memory, organisation and time management, and impulsivity. Then it goes on to have modules for comorbid and associated problems, in particular problem solving, interpersonal relationships, anxiety, frustration, frustration and anger, low mood and depression, sleep problems and substance misuse. And finally, a module about the future. It's really important to prepare young people for the future, and adults, because that's the first question. How long am I going to have this for? How long will I have to be treated for? What does the future hold for me? So it's really important to address that in your treatments. Each module has a standardised format. First of all, describes, characterises the presentation of the young person with that according to the topic. Advice about assessment. There's a psychoeducational section about what information needs to be given to the individual, and then there's loads of CBT techniques and strategies. That follows a summary, and then there's how you would deliver this in a group. There's advice with a group outline.